Sure, I can. So, to understand the American Care Act, we really need to go back a little bit to 2010, as you mentioned, and that was when our past president, or Barack Obama, he passed the Patient Protection and Affordable Care Act, commonly called ACA, into law, and that was really to help provide coverage for millions of Americans who were uninsured. And part of his goal was to really have comprehensive benefit coverage that included maternity coverage, prescription drugs, mental health, substance abuse, things like those. He wanted to ensure that every U.S. citizen had the right or were able to obtain healthcare insurance. Fast forwarding now to our last year, to 2017, our President Trump, he came into office with a promise to repeal and replace the act. And of course, the House of Representatives proposed some changes, and then the Senate also proposed some changes called the Better Care Reconciliation Act, and collectively, the House and Senate bills are now combined, called Trump Care.
Okay. Thank you for explaining that. I do remember that Donald Trump had talked about one of that being the actions he would take when he got into office, which would be to really make some changes to the original American Health Care Act. So as you explained, he was able to successfully do that. In your opinion, if you had to do a side-by-side comparison, what changed, or what would be the benefit or not so much of a benefit with the act as we see it today versus how it was presented in 2010?
Well, you know what? There was so much opposition that most people actually think the Affordable Care Act has been repealed, but it hasn't. The impact is still valid even today. And but of course, they're still trying to get those changed. But there are like about 9 differences that are really the key points that stand out.
Mm-hmm.
And one of them is the employer mandate. So what the Affordable Care Act covered was businesses with 50 or more full-time or even part-time equivalent employees must provide healthcare insurance, or they had to pay a penalty. So right now, the opposition to that is to eliminate that penalty. And so, of course, that will directly or indirect some of us, especially nurses who work for smaller companies.
Mm-hmm.
We might lose our coverage if our employers are not mandated to provide that coverage. Another primary benefit was or change was a pre-existing condition. So therefore the Care Act mandated insurance companies that they couldn't deny coverage or charge more for a pre-existing condition. So currently they're trying to deny, they're still in agreement with companies not being able to deny coverage, but they're finding that middle ground to say, okay, you can waive coverage or certain essential health benefits for people who have pre-existing medical conditions. So it's not completely trying to change that rule,
mm-hmm.
but it's making some changes to that.
I see. Overall, would you say that the American Health Care Act was a benefit, just kind of generally speaking, to the patient population or not?
I would say it was, because 32, I think it's estimated between 32 to 50 million Americans who were otherwise uninsured were able to gain access to the healthcare system, and they were able to access preventative treatment, especially. And as an emergency room nurse,
mm-hmm.
I remember I was working in New Jersey during that time, and I remember having an influx of patients who had recently obtained coverage, and those people were just anxious to get their checks done at whatever cost, so they came to the emergency room. But prior to that, a lot of patients would wait until they had an emergency condition.
I see.
So instead of monitoring conditions such as diabetes and getting their supplies to follow to check their blood sugar or getting their A1C test done, they would wait until they were in full-blown DKA and present to the emergency room. So then you would find an ICU admission, possible PCU step down, long-term. They would be the same one admitted for amputation, for just so much more management that could have been cost, it could have cost way less if it was done in the preventative stages.
Absolutely. That is a great explanation for the benefit to the general patient population. One other question about that. I do remember reading in the news that some people, due to the implementation of the American Health Care Act, they actually had an increase in their current coverage or lost their coverage that they currently had at the time due to this act. What would be your observation of that?
Could you repeat the question? I didn't hear the last part.
Absolutely. During the time they implemented the American Health Care Act, there were some people who actually had an increase in their current coverage for basically the same services, and then there were some people who actually lost their coverage. It was just too much to actually pay for. So what was your observation about that? Did you think that there were more people who experienced that, or overall patients having access to health care, you still kind of see that was more of the benefit there?
Yeah, it's hard to really say yay or nay regarding the coverage, because what happened initially, employers with 100 plus workers needed to have coverage, but then the Affordable Care Act reduced that to 50, which put some pressure on small business owners because they were mandated to offer so much more, this comprehensive package. They had to include all the preventative tests, maternity tests, things like those, and that put a lot of pressure on those small businesses. So that pushed the limits for most people for premium high, very high, because in order to offer those comprehensive package, it would definitely cost the businesses much more. So a lot of people who had minimum coverage, they were forced to update those to include all the benefits of the ACA, which of course was a lot costly. So a lot of people, some people chose not to be covered. And of course there was a penalty for that as well, because families were expected to pay, I think for adults it was about $695 tax. And for child who wasn't covered, it was like $347. So at the end of the year, a family may have been penalized to pay up to $2,000 per family. So multiple debates,
absolutely,
around the issue.
Absolutely, but I understand your point in saying that overall, the number of patients who were able to receive more of a preventive care increased, which overall helped to make the patient population, I would say, err on the side of a little bit more health consciousness and health awareness versus, as you said before, when there were no mandates, just not having access to health care and waiting until the last minute when it was like an ICU admission or a higher level of care versus just coming